This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. Public Health England has published a review which has confirmed that Black, Asian and minority ethnic people are more likely to die from COVID-19. It found that those of Bangladeshi ethnicity had around twice the risk of death than those from a white British background. Joining me now is Dr Chandra Kenneganti, who is chair of the British International Doctors Association. First of all, your reaction to what's contained in this report?
I'm glad that the report has been released. We actually contacted Matt Hancock this morning. Now, the report itself is showing what we already knew, that the people from ethnic minority backgrounds are disproportionately dying with coronavirus. It has shown some information which is important, like age remains the biggest risk factor. People of Bangladeshi ethnicity have twice the risk of death from people of compared to people of white British ethnicity. And we also came to know the risk is higher for other Asian, Caribbean, Black ethnicities too. But we already knew this information, and we want something to be done about this to prevent any unfortunate deaths of Black and minority ethnic communities across UK. This report does not show any actions.
But what kind of action can be taken?
So if the analysis have shown that a person's occupation is responsible for them to have a higher chance of them having the COVID virus and a higher chance of dying because of their health problems like diabetes, hypertension, which actually the report mentions, then we would need to protect them. We need to protect them from frontline jobs where they're exposed to this virus more. So that's a simple action we were trying to achieve. The analysis did not consider a person's occupation or obesity, even though we know that both are known risk factors for getting seriously ill with coronavirus. So there's a lot of advise people about the risk. It acknowledges in the report, but it has not gone further to come with clear actions to telling employers, for example, that if you do a risk assessment, these are the risks are there, so please protect your employees, of Black and minority ethnic origin.
So missing out that information because it doesn't include details on occupation and how that affects people, that's quite a major miss.
It is, and the report does look at disparities by age and sex, geography, deprivation, ethnicity, and other health conditions like diabetes, hypertension. That's good, but to be honest, we already knew that, and it has come with a lot of statistics. When 86 pages of statistics is not what we're looking for, even one page of actions, how to protect Black and minority ethnic lives would have made a huge difference. I think I saw the comment by our health secretary saying that they will follow this with actions, but I think the action should follow from now. We have so much evidence there which proves again and again the same thing we already knew.
Is this a medical problem or a societal one?
So we need to understand, is there a direct link with people's financial status and the COVID virus? We have to think about why this is not happening, the similar proportion in Indian subcontinent. Indian subcontinent had only 0.1 per 100,000 deaths when compared to what is happening here. We need to understand there's something happening in our country where more than just health conditions, there's something about their economic status and their deprivation is actually responsible for disproportionate causes of death in Black and minority ethnics.
You're a GP. Have you been worried about yourself as you've seen the figures stack up and seeing where it looked like it was going?
Well, I think it's important to recognize that the people who died more are 80 or older. They are almost 70 times more likely dying than those under 40. I'm 44 now. I have taken the risk, and I currently work in a COVID hot clinic where we see suspected COVID patients as a GP. We know that at some point we will get it. And when we get it, we'll be probably disproportionately much worse compared to others. So we are already accepted that fact that's going to happen. We're hoping that this research like this one, which is published today, will come with much more evidence about so that we can protect ourselves, we can protect our Black and minority ethnic colleagues who are in the patients facing roles and exposed to the virus on a daily basis.
And knowing all of that, knowing that you are likely to get COVID-19 and telling the government that this is what is happening, it must have been frustrating for you that nothing appeared to be being done.
This pandemic has exposed huge disparities in the health of our nation. So we're understandably angry about the way not much attention has been given about this important issue, which has been raised for almost now 2 months now. This is not the case that the actions have not happened yet. And we do have some kind of, we came with our risk assessment tools in general practice, for example, and we are protecting some colleagues who are at high risk of COVID-19. But that's because we did it ourselves, not because we have a proper guidance that has come from the government. But I'm sure when Matt Hancock, Health Secretary, has ordered this review, he did with good intention. I hope actually he follows his some good actions as well, so that at least some lives of Black and brown ethnic communities are protected from now onwards.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.